Many people wonder what is the largest health problem worldwide. Diabetes is one of the largest health problems we as humans struggle with. There is an estimated of 415 million people that suffer with this disease worldwide, and there is another 318 million who are greatly at risk for developing this disease. Today I'm going to inform some of you about the facts of diabetes. I'm going to explain to you what diabetes is and some of the people in the early age that discovered it and how some of the symptoms are that come along with this disease. Also, some of the therapies that can help people that have this disease. And lastly, some of the medications. I personally have some family members who have this disease, and it struck an interest with me. I found some very interesting facts about this disease. I researched a book called Diabetes, the Biography, and it stated in early cases of diabetes there was an Egyptian man in the 1500s, and he noted that he was passing too much urine, which is a symptom of diabetes. There was also a Hindu physician who discovered this disease as described it as honey urine. So some of you may ask, how did he know that it was honey urine? You guessed it, he tasted it. This man also noted that when the urine was on the ground, that the ants would come around it. So therefore, he figured out that there was sugar in the urine. These two men were on the path to discovering diabetes many years ago. Diabetes is a complex disease. It involves both genetic and environmental factors, according to the Journal of Nursing. Whether the diabetes is insulin resistant or insulin deficient, increased body weight, and poor diet are some of the risk factors for diabetes. According to the American Diabetes Association, some symptoms are urinating often, feeling thirsty or hungry even after you drank or ate, extremely tired, and tingling pain in the hands and on the feet. Secondly, I would like to point out some of the therapy treatments that may help with diabetes. Treatments come in many forms other than medication. One of these forms of therapy is getting support from your family. In the article, Family Support with Diabetes Self-Management, they conducted a study which proved that family support was a positive outcome for people with diabetes. The family is to encourage the patient to change their diet, which means a healthier diet for all who live under the same household. They encourage them to keep up with their medical appointments on a regular basis and to verify and follow their medications prescribed by their doctors and to check their blood sugar on a regular basis. With doing all this helped the diabetic person to live a healthier life, and some were able to be free of this disease. According to the American Diabetes Association, they suggest that one that has diabetes should check their blood sugar every day and record it so when they go to the doctor they can have a record of what their sugar levels have been doing. Lastly, I would like to take a moment about some of the medicines that a person with diabetes will be taking. According to the American Diabetes Association, people with type 1 diabetes must always take insulin. And people with type 2 diabetes can manage theirs with a strict diet and exercise, but their doctor may also prescribe prescription to be taken orally. Oral medication is meant to help bring the patients back down to normal. Other medications, such as aspirin, is also very helpful for people with diabetes. In closing, I have talked about diabetes, and I am probably sure that most of y'all in this room know someone that has diabetes, since there are millions of people in the world that are affected by this disease. I have informed you what diabetes is, who were some of the first people that discovered it, what are some of the therapies that can help with this, and some medications. And let's not forget to take our medications that the doctor prescribes for us daily if we are on diabetes. I leave you with a quote from Dale Evans. Life is not over because you have diabetes. Make the most of it. Make the most of what you have and be grateful.